Hey denture peeps, I wanted to hop on here and talk about wax try-ins. I had a message in my folder asking about what to look for, and I know I've made videos like this in the past, but they get lost in the algorithm, so let's talk about it again. So when you go for a wax try-in, you want to make sure that you love how the dentures look in your mouth, okay? It doesn't matter what they look like outside of your mouth, you know. These can look perfectly together outside of your mouth, but see how they go together perfectly? Every tooth is in every little groove. These need to look that way in your mouth. And when you smile, you want to make sure that, I don't have dentures, but I'm going to show you my teeth. When you look at your teeth, when you smile, you want to make sure that you're not showing a bunch of gums, okay? The lip should go right to the top of your teeth and just a little bit, below sometimes the very top of the teeth. So when you're smiling, you shouldn't see a bunch of gums. When you're smiling, you should be looking at the curvature of the teeth as compared to your smile, okay? They should have what's called a positive smile line, meaning that they go up in a positive direction, okay? Kind of curving up instead of curving down. So when you smile, you want to see these teeth kind of follow the curvature of your lips. If you smile and these teeth are going down, that is what we refer to as a negative smile line, and you don't want that. So if you see it, tell your provider, no, they're curving down. I don't want that. I want something that curves up, a positive smile line. You want to look at the midline, okay? The midline is where this middle of these two front teeth, okay, this line right here, bisects the middle of your face. Now, people make the mistakes of trying to look at that midline and lining it up with the middle of the nose. My nose is not straight, and most people, especially with age, their noses aren't totally straight. So you don't want to look at the nose necessarily. You want to stand back from the mirror and look at the middle of your face and make sure that that midline lines up with the middle of your face, okay? When you are smiling, you want to look at the teeth and make sure that they're not too wide, you know, in this area right here. So when you're smiling, you should see, you know, the front 6 teeth, and then just kind of the fronts of the first couple of molars, the premolars right here. So if you look at my teeth, you know, you barely see these peeking out. You don't want to smile like, and I don't know if you know who the Cheshire Cat is. The Cheshire Cat is a old-time cartoon character that when he smiled, you would see these big, huge teeth, you know, all the way across. You don't want to see that. That's too wide of a smile. You want to see a gradual, you know, going back of the teeth. This is kind of what I would refer to as, you know, kind of the corner of your ridge here, where that canine is. So you want to see a slight curvature of the teeth here on the front 6, and then it kind of make that corner and go back. So those are, you know, aesthetically what you want to be looking at, making sure that it looks pretty when you smile. You want to make sure that when you smile, it is straight, you know, so that the teeth aren't canted, you know, this way or this way, you know, make sure that it is straight and even. And this is very, very important. You want to make sure that the bite of the teeth coming together in the closed position is lined up perfectly. So outside of the mouth, I'll show you, these teeth go together perfectly, okay? There's no big spaces in here that you can see. I'll give you an example as if they were off, okay? Let's just move it a little bit. If you're looking in your mouth and the teeth are like this, okay, and there's spaces up here between the teeth, then the bite is not correct. When you look at your bite in your mouth, you want to see no spaces. No spaces, because you have to chew your food. It's like a mortar and pestle. you know, a mortar and pestle is the little kind of bowl-shaped thing, and you have the little tool that you rub and, you know, grind things. And that's how your teeth are. They're like a mortar and pestle. They need to be able to grind and move that food and masticate that food in between those teeth. So if you have spaces in there like this, you're not going to be as effective at chewing, and it's going to cause jaw pain. So when you're getting a wax try-in, first look at the aesthetics. The midline is correct. It's straight. It's not slanted. You want to make sure that it's gradually going back and not a too big of a wide smile. You want to make sure that your teeth are coming together perfectly, and you want to look at your support of your lips and your cheeks. You know, you want to make sure that when you are looking at things, that it's not, you know, puffing your cheeks out too much, your lips out too much, or that it's not sunken in, you know. All of those things you really want to pay attention to. And I cannot stress this enough. Do not agree or sign off on a wax try-in until you are absolutely thrilled with how those teeth look. Now, with immediate dentures, you cannot have a wax try-in because you still have your teeth in. So immediate dentures, you know, you're relying on the provider and their expertise in trying to get those teeth exactly placed where they need to be. And immediate dentures, it's kind of a crapshoot. There really aren't any guarantees when it comes to immediate dentures because we cannot try them in and preview them and do wax try-ins and make sure everything's okay because your teeth are still there. But when you are getting permanent dentures and, you know, you're already missing all of your teeth and you're getting that wax try-in, you want to preview them and make sure that they are perfect, that you love how they look. Look at all of those things. And, you know, I've heard tales on here of patients saying, well, the midline was off, but the provider said they'd fix that, so I went ahead and signed off. Don't do that. Do not do that. The provider can fix the midline, but they don't know that it's perfect until they put it in the patient's mouth and examine it and make sure, okay? Don't rely on a promise. You gotta have proof. You gotta make sure you love it. Take pictures from the side profile, the front profile, do all of that. You are the consumer. You are paying good money for these dentures. You need to advocate for yourself and make sure that you are getting what you're paying for. If you have any questions, drop them in the comments, and I'm really good about answering questions. And I will overlay the checklist that I have come up with a patient years and years and years ago to really stress to the patient what it is they're looking for and what they need to pay attention to when they're looking at their wax try-in. Okay, have a great day. Bye-bye.